Welcome to Concussion Talk Podcast. This is episode 103, and I'm talking to Jessica Schwartz, Dr. Jessica Schwartz. But first, I'd like to get my sponsor to say a few words, and so here's my intro for Head Check Health. Concussion Talk Podcast is presented by Head Check Health. Head Check Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on Head Check Health to improve communication and optimize care. Visit headcheckhealth.com for more. Okay, now Jess, Dr. Schwartz, Dr. Jesse Schwartz, thank you so much for being on this podcast. And Jess has been on this podcast for this our third time on the podcast. And she talked previously about her concussion, about her post-concussion syndrome, her practice in physio. She is a physiotherapist, DPT, physio. And she talked about her practice, her podcast, Concussion Corner Podcast. And now she has started up an academy in that same vein, Concussion Corner Academy. So welcome, Jess and Jessica, and please, could you please just introduce yourself and let people know just what they might have missed that they didn't see the previous or listen to the previous two podcasts.
Oh, hey, Nick, thanks so much for having me. And please always call me Jess. It's all good. How are you doing, brother?
Okay, good. Thanks.
So I'm so excited to be back on Concussion Talk. I tell people all the time, Nick, for folks that don't know me or don't know Nick, our relationship, when I got concussed in 2013, 2014, Nick was actually the first kind of stranger on the internet that I reached out to. And we were talking and DMing over Twitter and all that stuff. So I have so much deep appreciation for Nick. So I appreciate all that you do, brother.
Thanks a lot. Thanks. This is great. It's awesome. Thanks. Remember that. So you can just introduce yourself and just tell you what might have people missed to hear you on the previous two podcasts. What about you?
Sure. So my name is Jessica Schwartz. I am a physical therapist. I'm one of our national spokeswomen for the American Physical Therapy Association. I hold that title with pride. So I get to represent physios all over the United States for media and press. And I do that with so much pride, just both as a physical therapist and then somebody who went through physical therapy as a patient after my car crash in 2013, 2014. I underwent 10 to 14 hours of rehab a week for 14 months. After my concussion. And I have so much deep gratitude to my rehabilitative teams, PT, OT, speech, neuropsych, you name it. I kind of underwent it. So I appreciate everybody so much. And then I started a podcast in we started talking about it in 2016, 2017, and I put it to fruition in 2017. And our first episode came out for the Concussion Corner Podcast when I hosted the event at the Super Bowl, the concussion event for the Steinberg Sports in Minnesota at the Super Bowl. So they had a brain health summit. And then I launched the podcast there, and it's been going strong ever since. We're in over 50 countries, and it's so well received, and it's really supposed to push the Foam Ed initiative, which is free open access medical education. And boy, does it take a lot of time. Like, every podcast takes like 3 to 5 hours to produce and record and upload. But it's been a really lovely, a really lovely project. So I'm grateful to have been doing it.
So who do you talk to on your podcast, on Concussion Corner Podcast? And
so everyone's got their lane, right? So you kind of speak to a bunch of folks. I speak to basically all healthcare providers, interdisciplinary, from physician to athletic trainer and everybody in between, OT, speech, PT. And I also speak to survivors and thrivers, which we're going to be doing a little bit more robustly in 2022 and 23 to kind of highlight folks like myself and yourself, who kind of went through the rehabilitative process. So we can storytell that narrative to kind of hopefully change treatment for next day knowledge translation.
So have you, is there something you made, obviously, a lot about concussion, have gone through it and practiced and with that, but is there anything that you've learned on the podcast or you've heard of the podcast that you maybe didn't know as deeply?
Yeah, I mean, I learn every day. That's my goal, is to learn every day. So God, I've learned so much. I've learned from Jeff Kutcher, why we don't retire folks after 3 concussions, which was kind of like an old misnomer.
Yeah.
Back in the day when we were mismanaging patients a little bit more prevalently. I've learned from Dr. Christina Master, out of Children's Hospital of Philadelphia. She's doing wonderful research on looking at like why kids are neurofatiguing, right? They're using some head technology, looking at oxygenation to the brain, and then looking at cognitive tasks and how, we just don't have enough energy. It's like an energy mismatch. So it's kind of explaining the symptoms and fatigue and things that people feel that we aren't able to kind of quantify or qualify before. But now these folks are doing awesome research about that stuff. So I've learned so much, so I'm just so grateful to, have this kind of like implicit trust from the healthcare community to kind of just disseminate really smart people's work to kind of get it out to the mainstream public.
That's good. That's great. And that is the type of information that you'd like to share with all sorts of medical practitioners. So, and in that vein, you've created Concussion Corner Academy, and I don't know how much I'll butcher what you're into here, but you have a full description of what do you want to do with Concussion Corner Academy? What's your focus?
Yeah, so I'm hoping to kind of do it differently, right? So basically what was going on is that we've got this podcast which is free open access to the world, and I really believe in that, in serving and giving away as much as we possibly can, but like I'm an N of one, right? So but basically what happened is during COVID, I lost a lot of my practice. Like a lot of my patients passed away during COVID, and I don't want to harp too long on that because everyone's kind of going through something during this pandemic. So I just want to make sure that we're all encouraging each other to be kind to one another because everyone's going through something. And I lost a big chunk of my family during that time as well. And you kind of go through this kind of like crisis, right? You and I kind of recreated ourselves one time already, right? We lived with our brain injury and then we had to recreate ourselves. So I said, okay, this is kind of a second opportunity to kind of do that. And I was like, Jess, what do you want to do? And I really wanted to be full-time in the concussion space. And so with that being said, I said, okay, we're going to go all in on this. My entire savings and all that jazz. And I reached out to my network, right? And I was like, okay, I want to do this. Let's put this together. Let's make a community for folks. So basically I'm going to be creating, and we're launching November 1st. It's actually my birthday. So the business gets born on my birthday. Yep. Thank you. So I figured it'll be born on the 1st of the month with me, and it'll be a Scorpio. So hopefully it's successful. But yeah, basically Concussion Corner Academy, we're an online community and we're striving to facilitate collective competence across the healthcare continuum. So we want to just make sure that we're nurturing thought leaders across disciplines in compassionate care and psychologically safe educational environments. So our goal is to basically enhance that like provider patient experience in concussion care internationally. And a lot of folks have asked me like, hey, Jess, why do you say your vision is psychologically safe educational environments? And, quite frankly, Nick, folks like myself, I've gone through residency in orthopedics. I did that at New York University here in New York City. We've been through a doctorate. Folks go through residency, fellowship, all this stuff. And we kind of get traumatized by education. Like it's such a rigid way of learning and very strict. And, this is really just supposed to be a welcoming space for people who want to learn about concussion, but it's designed for the working healthcare professional. We're designing this to for folks that are working and that have like kids running around in the background or dogs or parents living with them because of everything that's going on with the pandemic. Everyone's lives have changed. And yes, I do anticipate getting getting back to traveling, but we've got to make this accessible for folks. So we're going to, I'll tell you about that later, how we're going to deliver and design the program, but we're making it for healthcare professionals that are working full time.
So who exactly can, anybody, nurses, doctors, physios, athletic trainers?
So
like all therapists, OTs, and speech language, and so
absolutely. So for the first beta program, now beta doesn't mean you're getting anything less. We're just wanting to study how we're doing everything so that we can deliver the best product to healthcare providers. So beta just means for us that we're studying ourselves, right? So hopefully we can deliver the gold standard in education. But we're going to be partnering with a company, and we're going to be CEUing for the American folks in all 50 states for both physical therapists and athletic trainers for the first beta course, which is going to launch January 16th to April 10th. So it'll be a 12-week program, 2 to 3 hours per week. And I'll tell you more about that later, but it's designed for rehabilitative professionals. So it is designed for physicians and physician assistants and athletic trainers, PTs, occupational therapists, speech pathologists, nurses, social workers, neuropsychologists, mental health professionals, things like that. So it is designed for everyone in healthcare. And it's basically with the whole premise of, hey, here's what I can do as a physician or a physio, and here's what you can do, and here's how we can work together. So it's really designed to discuss best practices in interdisciplinary care.
So you did, that sounds amazing. You also highlighted your partnerships and why you're doing this and who you're in this for. I know you're doing it for medical professionals and rehabilitative, but like the brain injury community and the nonprofit partnership. So talk about that. Your more existential wise. Why did you create this course?
Yeah. So, the goal is to have like a really low ego with this. And I don't know if you found this, Nick, but I found like if you have, God forbid, if you have cancer or if you have a heart attack, you go to one healthcare professional, right? So you go to the cardiologist, or you're going to go to the oncologist, and they're going to take care of all of your needs. The difficulty with people with concussion, like myself, and you had your brain injury, is that there are infinite ports of access to care with concussion. So you can go to the emergency department, urgent care, PT, school nurse, even your OBGYN. It sounds funny, Nick, but you could go to the gynecologist as a woman, as a female.
I can.
Right. But 50% of the population can, and they could maybe go. They could be pregnant or going for their annual exam, right? And then maybe they had an accident over the weekend, and that was the first healthcare professional that they saw, and it wasn't on purpose, but just by happenstance. Yes. So we want to make sure that folks are getting pushed into the right care coordination and care management for their best possible outcome. So we want to make sure we're encouraging openness and fostering compassion with community support. So what I really wanted to do was, I asked myself, how could I do this differently? Everyone's kind of doing something these days. And I said, other than having it be completely interdisciplinary, I wanted to make sure we're supporting the brain injury community and the concussion community. So we're partnering with Headway Foundation with, Paige Decker, Josephine Pucci, and Danny Otto, who formed that foundation. Who also, kind of like myself and you, also had their own brain injuries. And so we're going to actually partner with them, and we're going to give a portion of our proceeds, our profits, when we become profitable, over to Headway. And then we'll also partner for future with other nonprofits like Pink Concussions and things like that. So we want to make sure that we're giving back to the brain injury community. And then hopefully at some point, maybe during phase 2 and 3, I'd also like to hire folks that are brain injured as well and make it more like task supportive, where they can be a part of something, a part of our community, and maybe do things like write a copy for our social media post, and just making sure that we're setting up our fellow brain injured brothers and sisters up for success and make them feel connected to a community.
That does, again, it sounds like a broken record, but it sounds like an incredible idea. And so
thank you.
who is teaching? Who is going to be delivering the information for this course?
Oh, thank you so much for asking. So I'll be moderating and giving some of the introductory coursework, but we have a full faculty, and it's so important that we cross disciplines. So for this first program, we're going to have January 2022 to April 2022, which is so crazy. It's going to be 2022 soon. Yeah. We're going to have that. And then we'll also have another program later in the year in September to December, with other interdisciplinary providers. But again, we're in the beta program, so we're launching slow and steady. So our first faculty, there's two, they'll each have 2 weeks of the 12 weeks, and we have 6 faculty. We have Dr. Christina Master, who's an incredible physician, a pediatrician, sports medicine physician over at Children's Hospital of Pennsylvania, CHOP it's called, and she is so in tune with the brain injured community, with the concussion community. She not only is treating patients, working with families, but she also is a clinician scientist where she's publishing tremendous work, breaking down the barriers to access to concussion care. So she's doing our pediatric section for 2 weeks. Dr. John Letty is doing our adult section for physician examination, and also reviewing his own, protocols with the Buffalo Concussion treadmill test and the Buffalo Concussion physical examination and the Buffalo Concussion bike test. So he'll be reviewing his own work and teaching our students how to do that as well. We have Lenore Herget, who is a tremendous physical therapist. I mean, just all these guys are top notch. I mean, really top 5 in the country. Both of our guys, our ladies, I should say. But Dr. Herget's board certified in sport. Also specializes in vestibular. She is a sports physical therapist out of MGH and Harvard, Mass General Hospital and Harvard University. And she's a concussion rehab consultant for basically every professional sports team in Boston. So she does really good work there. She'll be doing our physical therapy examination. Dr. Carolyn Baxter is out of Utah. She was with the U.S. ski and snowboard free ski half pipe team. And she was their regional director for a few other concussion clinics, and has her own clinic, Motion Utah, in Utah right now in Park City. And she's a tremendous physical therapist, going to be doing our physical therapy interventions. We have Dustin Fink, who's an athletic trainer out of the Illinois area, and he started the concussion blog. And I mean, at the peak, that blog,
first guy across. See, first concussion blog I came across when I started my blog in 2010. So yeah.
Really? Yeah. So, right. So same thing. So when he was at his peak, he was getting over 1 million hits on his website, and he spent over 7,000 hours researching and understanding concussion. So he's doing our athletic training section. And then finally, for the last 2 weeks, we have Dr. Brenda Egan Johnson, who got her educational doctorate out of Johns Hopkins. And Brenda is amazing. She does everything in terms of return to learn, return to school for pediatric child and adolescent and like college. So she's going to be talking about all of those aspects that healthcare providers need to understand on how to navigate some of the legal aspect and some of the return to school, because we want to make sure that we're returning our students to learn before they return to play. And that's so important to connect to. So how as healthcare providers can we get them to do that, as effectively and supportive as possible?
Well, so that's your roster so far, I should say. But
we're gonna have over 20 to 30 faculty at some point, but that's our first 6, and I'm so proud to have them be a part of our crew.
And the rest of 6.
Yeah.
So
absolutely.
So I guess as I listen to that, you kind of I feel we should understand how you're different than any other educational institution, because you're doing it from home and you're multiple people from different places, parts of the country and stuff like that. But how would you say you are different from any other company or educational institution?
That's a good question, Nick. So I want to make sure that we're doing a little different, right? So we're going to have that nonprofit partnership with Headway Foundation and then other nonprofits as we grow. So that's really important to connect not only ourselves as an academy, like the ego as I, right? But also that our students get integrated with the concussion community. And, we're so underfunded and previously poorly researched. With cancer, there's trillions of dollars in research, and with traumatic brain injury and brain injury, there's maybe millions, hundreds of millions.
Yes.
So, so how can we support those that are really working hard? So one, our nonprofit partnership makes us different. Two, we're going to eventually be hiring folks with brain injury for kind of like task-based things. And I thought about this, like, someone who lives with neurofatigue and an ocular motor and some vision deficits since my own concussion and dysautonomia that I live with as well, with my autonomic dysfunction. I said, how can we support folks with brain injury? So, hiring someone full-time or part-time could potentially affect if they're on disability. So we're thinking of creating task-based things so we can pay somebody like $30 a task or $50 or $100 per task. And then we can give them 2 to 4 weeks to do that. And just as long as they can get it done at their own pacing. And then, doing that. So looking to hire folks with brain injury. And then we're actually getting IRB approval from, I can't let it be known right now, but from a university, and we have to get approved first before I can say it, but we're seeking IRB approval to actually study our students.
As a ignorant Canadian here, what is IRB?
IRB is an internal review board. So it basically is a review board at a major university or hospital to make sure that we are not doing harm during a study. And this is only informational, right? So it's a pre-test and a post-test, but we're going to be looking at validated measures of self-efficacy and knowledge translation, specifically with concussion education. So, hey, I, as Dr. Schwartz, I took this course before, or I didn't take this course before. Here was my knowledge level and comfort. And hey, I'm Dr. Schwartz. After I took this course, here's where my knowledge level and comfort is. And we have validated tools to kind of assess this in our learners that are doctors and therapists and rehabilitation providers. So we're going to study our students to make sure that we're delivering the best possible education from a gold standard standpoint. And I don't think anybody's doing that out there either. So I think that really differentiates us from anything else that's out there.
Wow. So these courses will start in January, but on November 1st, people can register for this course, this academy.
You got it.
And
you got it. Yep.
And with that said, we want to encourage people who are eligible to please sign up and if you can, if these courses are just amazing. You have amazing teachers already. So, but you have an affiliate program as well. So what is that about?
Yeah. So, I when I used to be in private practice, I learned from lovely mentors and things like that. But the number one thing for business in general, like if you've got a pizza shop in Canada or you've got a physical therapy practice in Australia, the number one thing we can do for in business, and quite frankly, and that's where I'm deeply connected to, and sometimes we lose that, right? If we get too busy or overworked or burnt out, it's connecting with people. So we're going to have a really robust affiliate program. One, I straight up don't have the cash to like pay for commercials or advertisements. Yeah. I'm not going to lie. And two, I really want to get to know folks. So we're going to have a really robust affiliate program with putting people on the ground, bootstraps on the ground. So, if you sign up for our affiliate program, you'll get to meet me for a 15-minute coaching call. And then two, you'll get your own unique affiliate code, just like Nick on Concussion Talk is going to have his own affiliate code that's going to support Nick and Concussion Corner. Concussion Talk. And it'll be $75 for affiliates. So if you refer somebody over through your unique link after you sign up with us, we then have a 14-day return policy. And on that 15th day, after that money, stays in the bank and the person doesn't want to have a return, then, we'll pay you out. We have in 90 days, but the goal is going to be to pay people pretty quickly within the same 2 to 4 weeks after people sign up. So we'll pay that, directly through like a Zelle or a Venmo or a PayPal. We're still figuring that out, but we're trying not to write checks like it's 1997. So we're trying to do everything digitally. But yeah. 1997 is just when we were writing checks. So, so now we've got bank accounts with the.
There's something special I missed about 97. I was like, I'm around 97. I don't remember anything special about it, but
yeah. I know my mom was writing checks. I was in middle school, so.
Nice. Well, so is there anything else you would like to mention about Concussion Corner Academy? You have a CCA, written CCA in the notes I received about it. And I was going to call it CCA, but you had to call it Concussion Corner Academy.
Yeah, I think our website's concussioncorner.org. So we'll have the podcast has been living at concussioncorner.com. So we're going to combine things with the .org. But so, stop on by, listen to the podcast whenever we're everywhere. Please support us. It helps us so much. And by us, it means me, but by my life and business partner is my girlfriend. So she does, a lot of the editing for us in the background as a graphic designer. And, it supports us so much to get a 5-star rating on the podcast. You're supporting a small business owner like myself, also a brain injury survivor thriver. So it just, the support means so much. And then if you'd like to learn about the Academy or sign up, you can sign up for our newsletter and be a part of our community. Eventually we're going to have a really robust network of, videos that are going to be searchable. What also makes us different, I forgot to mention, is that we're actually animating all of our own instructional videos. So, so that'll be pretty cool too for learning. And also our software that we're using for our school allows us to have interactive stuff. So it's not going to be like a plug and play where you walk away and you take a quiz. It's going to be interactive. You can quiz in the middle of it. We'll provide call outs and questions in the middle of it to make sure that you're learning. If you get it wrong, it'll actually rewind you back to the place of where we taught that piece of information, just because our goal is to facilitate next day knowledge translation. And our goal is to set you, the student, up for success. So I'm really pumped about all that stuff as well. But just visit us over at concussioncorner.org, www.concussioncorner.org, and come hang out with us, come meet us. We're going to have coaching sessions and coaching sessions and I'm drawing a blank here, Nick. Office hours. We're going to have office hours twice a week. So you get to hang out with me. So it's going to be, really interactive, all done on Zoom.
Nice. Well, as this August was also done on Zoom. And so I encourage everybody to visit www.concussioncorner.org. And while you're at concussioncorner.org, just switch that to .com and check out the website, the podcast. Concussion Corner Podcast with Dr. Jess Schwartz. And I'm not sure if you know when your next podcast will be out, but hopefully out soon. And like with this one, I'm not sure when people are listening to this podcast, but or if you've seen my posts on either Instagram or even just on Apple or something, whatever, Apple, SoundCloud, Spotify, YouTube, whatever, Amazon, wherever you get podcasts. But there's a note on the bottom that my affiliate code so please sign up for Jess Concussion Corner Academy. The affiliate code is at the bottom of the show notes. So you definitely helping Jess out and as just mentioned me out as well. So thank you again, Jess, and best of luck with this academy.
I appreciate you, brother, and thanks so much. And yes, please support Nick and Concussion Talk by using our affiliate code, because that supports not one, but the both of us. And we really put hard work into these podcasts, delivering them for free. And this takes time and money. So we appreciate you guys for supporting the both of us. So thanks so much for having me on.
Thank you, Jess. Music at the beginning of this podcast is by Ben Sound, www.bensound.com.